On behalf of the rest of UPAndo Latinoamérica, Dr. Mandip Dillon and Dr. Reina Huerta, I want to thank you for the invitation. It's an honor to be here, and we're quite excited to share with you the lessons learned in Mexico with regards to point-of-care ultrasound and FOMID in Spanish. So we have no disclosures. And I think the best place to start is with our name, UPAndo. Where did it come from? How did we get there? And so this will take us back to the early days when we were first discussing the mission and vision of what eventually would become UPAndo Latinoamérica. And at that time, we were looking for a name, and we wanted to use PoCUS, but we were somewhat frustrated with the fact that there was no term in Spanish that was equivalent to PoCUS. So people would just say PoCUS to refer to PoCUS. And what we wanted to do is we wanted to reappropriate the term. And so we decided to translate it into Spanish. And we came up with UPA, ultrasound del punto de atención. And then we played a little bit with grammar and conjugation, and we made it a verb. So UPA became UPAndo, and UPAndo can literally be translated into PoCUS. And that's our name. So next couple of minutes, I'll discuss why we did it, who we are, what we did, and how this can help you as a point-of-care ultrasound educator. So why? It was close to 2021, and this was the aftermath of COVID, when more people were made aware of the advantages of point-of-care ultrasound in the acute setting. And this was coupled with an increase in accessibility of handheld devices, where there's a momentum in Mexico where there were many healthcare providers who were interested in PoCUS and who were actually already using this. Unfortunately, there was a lack of resources for these newly enthusiasts. And so we decided to fill that void. And so what we wanted to do is we wanted to design a website that was in Spanish, that was free access, that was evidence-based, and that we could, where we could upload carefully curated videos that in a very simple way described complex concepts and did so in a visually appealing and entertaining manner. So that was what we were looking to create. And the team is made up of emergency medicine physicians. We're all female. We come from different backgrounds. We have different training. We work in different places in different clinical scenarios, but we had a same idea. And so at that time, Dr. Mandip was based in Orizaba, Veracruz. I was in Tijuana in Southern California, and Reina was in Guadalajara. And so what did we do? I think the best way to do is just to show you. So I invite you to buckle up, and you can use whichever browser you want to use. And you type UPAndo Latinoamérica. This will take you to our website. This is our homepage, where there is a menu that links you to different resources. But our main one is this one over here. So this is our suggested curriculum, and we've divided it into basic, intermediate, and advanced ultrasound core applications. And we've also included knobology as well as basic physics. So how did we come up with this curriculum? Well, given the lack of national as well as specialty-specific ultrasound guidelines, we had to use the American College of Emergency Physician ultrasound guidelines to come up with the different core applications that we were going to include. And in addition to that, we also used our experience and our understanding of the Mexican healthcare system to decide what was needed or what we needed to include. So given the fact that in most public Mexican emergency departments, there's a lack of, or there's limited access to IV analgesia and procedural sedation, we decided to have a robust component of multimodal pain management, which of course included also ultrasound-guided nerve blocks that can be done by and in the emergency department. So this was an important addition. And we also thought that it was important to include a more robust curriculum that includes second and third trimester pregnancy. So let me just show you a narrated case or a narrated video. This was created and narrated by Dr. Dillon.
Hola, soy la doctora Mandip Dillon y sigamos nuestro programa de UPAndo en Latinoamérica con esta plática de UPA renal, una aplicación de ultrasonido en el punto de atención que me encanta ocupar en urgencias justamente por la frecuencia con la cual vemos pacientes en los cuales se puede aplicar y cómo esto viene a cambiar nuestra práctica clínica. Vamos a contestar principalmente la siguiente pregunta en esta clase de hoy, y esta es: ¿cómo voy a usar ultrasonido en el punto de atención en el abordaje de pacientes con sospecha de nefrolitiasis? Entonces,
so this is just a trailer of that narrated lecture. In addition to that, we also have worksheets for the different core ultrasound applications that people can download very easily. So these were also adapted and translated from ASEP. And so, as you would expect, the user needs to define if this is a diagnostic or educational study, the indication for the study, the different views they obtained, as well as the findings per view. And finally, they need to describe or give the interpretation of their point of care ultrasound imaging. We also included a component of QA where an independent reviewer can rate the quality of the image obtained, as well as the diagnostic accuracy of the interpretation. So in addition to the worksheets, we also have links to resources as well as to relevant literature based on each topic. And in addition to these kind of longer narrated lectures, we also wanted to have shorter case studies. And this is an example of one of these that was created and narrated by Dr. Huerta.
Hola, el día de hoy observamos la siguiente radiografía donde nos hacemos esta pregunta. ¿Mi paciente tiene derrame pericárdico? Para realizar un abordaje a este paciente, decidimos realizar un rastreo ecocardiográfico donde insondamos para esternal eje largo, eje corto, subsifoideo y apical 4 cámaras. En la siguiente imagen observamos que nuestro paciente no tiene derrame pericárdico, sin embargo tiene una dilatación muy importante de cavidades izquierdas. Además, podemos inferir que este paciente está cursando con una insuficiencia cardíaca.
So in addition to these short case studies, we also have infographics that our users can download and use as they please. So that was a quick review of our website, and we're very proud of the work that we've done. And so despite our somewhat rudimentary marketing strategies, which basically involve word of mouth in conferences like these, where we can spread the use or the word of what we're doing with UPAndo, we also share the website through sporadic postings in social media. So despite this, we have around 1,000 visits a month, not only from Mexico, but from other countries in Latin America, such as Colombia, Guate, Chile, Peru, Ecuador, Venezuela, as well as Spain. So we're proud of what we've accomplished. So how can UPAndo be used? Well, we believe that we offer a simple solution to point of care ultrasound educators by providing a free platform that allows asynchronous learning on demand. And the way how we've used it in collective workshops that we've done in the past is by sharing the links to the participants before our workshop in order for them to review the cases or the topics that we're going to discuss. And that allows us to dedicate more time to teaching psychomotor skills as well as clinical integration at the bedside. We've also had some individual examples. For example, Dr. Huerta does some SIM cases at the Mexican Social Security in Guadalajara, Jalisco. And what she does is she uses the narrated lectures from UPAndo of EFAS and the narrated lecture on ultrasound-guided central venous access during her SIM cases. On the other hand, the experience that I've had at the border, in the U.S.-Mexico border, mainly in Tijuana, but also in cities such as Mexicali and Ensenada, is we have a collective called UPA North that is made up of residents from different specialties, including emergency medicine, as well as general physicians and emergency medical technicians. And here we have a longitudinal curriculum that spans 10 months. And during each month, we will review different topics. And the participants of UPA North will have access to the different narrated lectures beforehand, and they can review these before the monthly sessions. And then once we have our monthly sessions, the lectures are shorter, they're case-based, they're given by the participants. And then we have more time to spend on the small group hands-on training where actually the instructors are the participants who received an hour of individualized training prior to the session. And I'm very proud to share with you our most recent event, and this was the very first UPA Fest that was done in Mexicali on October 28th. And here we use gamification with a theme of the traditional Mexican lucha libre, hence the music in the background. And during this event, around 40 residents, medical students, and EMTs went through different stations and practiced different applications, and we had a blast. In addition to learning, we also had some prizes for the first, second, and third places. So we hope to do this again next year. In addition to UPA North, I also am focused on pre-hospital point-of-care ultrasound and training of EMTs. And here I've designed a program that spans throughout the entire year. And the way how we decided which clinical applications to include was based on the analysis of the most frequent chief complaints in the pre-hospital. And so based on the data analysis, what we came up was that the higher or the highest yield clinical or core ultrasound applications were EFAST, the use of point-of-care ultrasound for ectopic pregnancy and third trimester emergencies, as well as thoracic and cardiac ultrasound, and also ultrasound to help identify undifferentiated shock and to use during cardiac arrest and ETT confirmation. So EMTs are provided with links to the narrated lectures, and then this is coupled with small group hands-on training, as well as ambulance or hands-on training during ambulance rides and monthly QAs via Zoom. And this has just made me discover and interact with amazing paramedics such as Abraham Valencia that you can see in these pictures. In a very short period of time, he's been able to showcase his incredible ability to both acquire and interpret images. So this is a case of a gunshot wound where he quickly identified the presence of a lung point. This is another case of a patient with blunt trauma where we quickly identified the presence of non-compressible hemorrhage in the case with hemothorax, and he was able to quickly triage and transport this patient to the definitive care. So what are the challenges, successes, and goals of PoCUS in Mexico? I would say that in Mexico, there are limited machines. And so there are very few emergency departments that have dedicated machines that are available 24/7. And this, of course, limits usage. In addition to that, we don't have ultrasound archival systems where people can actually store their images. And thus, because of this, the images are not reviewed, and it's very difficult to actually have quality improvement processes. And so I think this is a very important piece of ultrasound management that we need to work on. In addition to that, as I have alluded in prior slides, there are no national directives that clearly define the scope of practice, and there are no benchmarks for training and credentialing, which likely explains the lack of integration of point-of-care ultrasound in undergraduate and graduate medical education. We do have, however, a few mentors in the country. There are various groups that offer short courses. However, these usually are expensive with limited hands-on and without any follow-up. So these are our roadblocks, and we need to work on them. I think that the successes that UPAndo has accomplished are filling the void of point-of-care ultrasound Spanish FOMID, and importantly, with an understanding of the realities of the Global South, which is important whenever you discuss sustainability. We also think that we've advocated for accessibility and democratization of PoCUS resources, and we've shown the feasibility of using PoCUS beyond physicians, and this clearly will increase the usage in patients who need it the most. What are our goals? We want to offer credential longitudinal training. We want to contribute to the integration of PoCUS in School of Medicine and graduate training. We want to consolidate QI processes in different sites. And we want to continue to empower healthcare providers in marginalized communities through PoCUS training. So thank you again for the invitation. And we leave you with this last message. Thank you.